there, YouTube. Welcome back to my channel. If you're new here, welcome. We're happy to have you. I want to ask your forgiveness because my voice is a little low and raspy, and that's just because I just had a hysterectomy. They did intubate me, so that's probably part of the reason. And then I am still feeling some abdominal pain. So this video, I'm going to cover what happened after my pre-op leading up to today, which is my first full day of recovery. Yesterday is when I had the surgery. Today is the 18th of November, 2025. So on Friday, the 7th of November, I had my pre-op with the doctor. I kind of covered that in a previous video, but he pretty much gave me my consent forms and went over what to expect from the surgery. And yeah, that's pretty much it. And then I got a phone call from the hospital on the 13th of November to ask me some follow-up questions, also to give me expectations of what is going to happen, give me my pre-op instructions. And part of that was to come to the hospital the following day, which was the 14th of November, to have some blood drawn. So I did that. When I went to the hospital, they gave me a wristband that I had to wear all weekend, but they put it on so loose, I just took it off. But I just remembered to pack it in my bag so that I would have it when I checked in. They also gave me 4 nutrition drinks, or I'm not exactly sure how to describe them, but I'm gonna insert some pictures here. So I had to take 2 on Saturday, one with breakfast and one with lunch, and then 2 on Sunday, same deal. And they gave me another drink that is kind of, I guess, carbohydrate load, and it's to assist in your recovery, help you feel better and come out of anesthesia a little easier. And so I was to take that drink 4 hours prior to reporting to the hospital. And so, like I said, I'll insert pictures here. Excuse me. Part of my pre-op instructions were to start fasting 24 hours prior to reporting to the hospital. So the last time I ate something was about 2:45 Sunday morning, and then the procedure was Monday morning. I had to report to the hospital at 5:30. Also, the night before surgery, I had to administer an enema. Sorry, TMI, but you know, they want things cleared out. That was a different experience. That was my first time ever doing that. Yeah, so I think that's pretty much it leading up to surgery day. I packed a bag. They tell you not to bring anything in the hospital, no valuables or anything, but I did pack a small bag with some essentials, my post-op medication, extra pair of underwear, toothbrush, toothpaste. I had my ID, insurance cards, and that kind of stuff for my mom to hold on just in case I did have to stay the night in the hospital. It wasn't expected that I have to stay the night, but you just never know, so I wanted to be prepared. I arrived at the hospital 5:30. They checked me in, gave me another wristband, and they took me back to the pre-op area a little after 6. So there they had me change into a gown, and had to wipe myself down with these chlorhexidine wipes, also known as Hibiclens. Oh yeah, part of my pre-op instructions, I had to take a shower on Saturday, Sunday, and Monday prior to arriving to the hospital using this Hibiclens. It's like a red antibacterial soap. So I had to bathe with that for 3 showers and not put anything on after. No lotion, no moisturizers, nothing. But when I got to the hospital, they had me do that one more time, but they had these wipes. I think it was a stronger concentration because that stuff was burning my skin, especially under my armpits. It was almost unbearable. But you know, they want to make sure that you're clean, so I did that. Excuse me. When I got in the bed, they hooked me up to IVs. Now, I'm going to divert for a second. Funny story. So if you didn't know, I used to be in the Air Force. And just being in the military period, you get poked and prodded all the time. You get used to it. But I've been with myself for 39 years of my life. And I've been with myself every single time I had to get poked and prodded. I know that I have tiny veins that like to hide, right? So I tell every phlebotomist, every nurse this, and I tell them I don't doubt your skills, but they usually have to use a butterfly. Now, obviously, that doesn't matter when they're putting your IV in, but it's normal. I ended up getting stuck 4 times. The first stick, they were able to get the IV in this hand. Then they tried in this hand, didn't work. They tried in my arm here. You can kind of see the bruise. Well, maybe not because of the lighting, but oh well, it's a bruise there. And then they had to go back in my hand over here where they finally got it, and you can kind of see the bruise there. But yeah, so I had to have 2 IVs, and that was fun, getting stuck a lot. After that, the nurse came in and she gave me a cocktail of drugs, some Tylenol, gabapentin, and Celebrex, which I guess were to start my body on some anti-pain medication prior to the surgery. They also gave me 2 antibiotics that they gave intravenously. They wrapped these compression things on my things on my leg that they were going to hook up once I got into surgery to keep the circulation flowing so I don't get blood clots. They also took my blood pressure and my blood sugar. Then they took some more vials of blood. They were able to do that through the IV. And let me see, I have my notes here written, so let me see what's next. Oh, with them taking the blood, they do that to double check my blood type and make sure I'm not pregnant. Then they asked me a series of health questions, just kind of reiterating everything that I went through in pre-op and in the phone call the nurse gave me prior to me going to the hospital. They predicted that the surgery would be about 3 hours. I don't know exactly how long it took, but I went in. My staff was really nice. I tried to remember all their names. I wrote down as many as I could, but the ones that were in the OR, I was out so fast that I don't remember their names. But when I woke up, my mother was there, and the whole staff in general, they were really nice, very helpful, very patient. So I came into the recovery room, slowly woke up, and the first thing they had me do is drink. One of my requirements to leave or to be discharged from the hospital was to urinate by myself, not on myself, by myself. And I ended up being there until almost 5 o'clock that evening. And the only reason I was there that long is because I couldn't go. I was drinking. I could feel my bladder filling up. It was so painful. And they finally had to do a straight catheter to empty my bladder. And once they did that, I was able to go on my own. I think I went 3 more times before I finally left the hospital. So I came home after I was able to pee by myself, and I got settled in the bed. My mom brought me some food. I only ate very little because the gas pains were already kicking in. Before I even left the hospital, I started to feel some pain, and so the nurse gave me some Percocet. And I would say by the time we got home, it had started to kick in, so the ride was a little bumpy. My doctor recommended that I bring a pillow to put on my stomach and then put the seatbelt over. And then I had also seen that in some other videos, but it didn't help just putting the pillow on my stomach itself. The incision scars, or not scars, but the incision points, they were painful just to have anything touch it. So I did put the seatbelt on, but I held the pillow away from my stomach. But if anything, were to happen, it was there to protect me. Got home, saw my baby, and he couldn't quite understand why he couldn't hug me frontal. So he did like a little side hug, and I kissed his forehead. My mom gave me a little bit of food. I didn't want to eat too much because I didn't want to exacerbate the gas pains. Drank water, took my meds, and I think I peed like 5 or 6 times since I'd been home, just from the time I got from the hospital till throughout the middle of the night. So yeah, yesterday I slept on and off, responded to some text messages, and called a few family members just to let them know I was okay. And then today I've gotten up out of bed a few times to walk around. They say, you gotta walk to prevent blood clots, and you just gotta get up and get moving. It'll speed up the healing process. So I've been doing that, but I can't do it too much because the other pain medication they gave me was oxycodone, and it makes me very dizzy. So like even sitting here, just little movements of my head, I get dizzy, so I have to be very careful. But I still try to get up and walk. I got up and fixed me something to eat. I've been taking Metamucil and Colace to make sure that everything flows through and it's soft and I don't have to push too hard. I did have some coughs this morning and bringing up some phlegm, in which they tell you to take several deep breaths throughout the day to prevent pneumonia. And I see why. Like, I don't feel like I have pneumonia or symptoms of it, but just bringing up phlegm out of my chest and the coughing, it really hurts. You just got to get those deep breaths in to prevent that. Keep your lungs open. I was able to take a shower today. I feel so much better after showering and putting lotion on, because that Hibiclens that they have you bathe in really dries your skin out, and I couldn't put anything on, so I got some lotion on, put a little perfume, smelling good, even though I'm in the bed, but it makes me feel better. So yeah, my pain level today, they asked me that yesterday too. It's probably been like 3-4, which is not super painful. I think I'm managing it well with the pain meds. It's just really uncomfortable with the gas. I was finally able to pass gas today. I've been burping since yesterday, but it finally came out the other end. TMI, I'm sorry, but this is part of the process. So that was relieving, but there's still so much more trapped, and I can feel it gurgling and churning about, so I can't wait till I'm able to release it all. I think that I'll feel even better after that. I did have a little bit of bleeding vaginally, just spotting. It's so light. So I am keeping protection on down there so I don't mess up anything. I don't know how long that's gonna last, but it's nothing to be alarmed. It's normal. I think that's about it. So yeah, I'm gonna end this video for full day 1, but day 2 of my recovery from my hysterectomy, and I'm gonna insert some pictures of my scars. I keep calling them scars, they're not scars yet, but the incisions, and a couple pictures of me in the hospital yesterday. But thank you all for watching and joining me on this journey to having hysterectomy and recovering. Be blessed. I'll see you in the next video. Don't forget to like, comment, and subscribe below.